2023. Celebrating innovations, celebrating the pioneers of the stroke care sitting amongst here today. This evening, as we said, we aim to recognize and celebrate outstanding contributions and achievements in the field of stroke care, research and innovation. This recognition ceremony serves as a platform to honor the dedication and innovation of individuals and organizations committed in advancing stroke care, prevention, treatment and support, and ultimately contributing to improved outcomes and quality of life for the stroke survivors worldwide. Through these awards, we aspire to inspire so many more and further progress in collaboration towards the industry and the betterment of the stroke care industry. Before we begin with the final award ceremony and felicitation, I would like to call upon the stage Dr. Naveen Nischal, Chairman Voice of Healthcare, to share his opening remarks. Can we have a round of applause for sir, please?
Thank you, Khushbu. Thank you very much. Respected Rushikesh Ganesh Bhai Patel, Honorable Minister, Ministry of Health and Family Welfare, Gujarat. Respected Rajiv Arora, Chairperson, Quality Assurance Authority, Government of Haryana. Co-Chair, Expert Group, National Center for Disease Control, Ministry of Health and Family Welfare, Government of India. ISA Office Bearers, Dr. Anand, Dr. Arvind, Dr. Nirmal, Dr. Sudhir Shah, and all innovators, policymakers, students present in this hall, a very warm welcome on behalf of Voice of Healthcare for award ceremony. Today we are going to celebrate the achievements of those who have done some remarkable work in stroke care. And this occasion is really, it has reached to a greatness with the presence of Honorable Health Minister of Gujarat. I would like to congratulate all the awardees in advance for such a big achievement. We need recognition, we need awards, we need appreciation. All these things are necessary to reinforce our belief that we are on the right track. Even a smallest of recognition changes our outlook to the life. So recognizing people at various stages is very important. But when we speak about healthcare, it is a different field altogether. Recognition in healthcare comes with a lot of responsibility. Therefore, it becomes more significant to honor those heroes of humanity. But selecting the worthy ones was even more challenging. So the task was not that easy. It not only involves selecting criteria on the part of jury, but it also involves the hard work put in by every candidate who has come this far. It doesn't mean that left out candidates are not worthy. You would be surprised to know that even Mahatma Gandhi was also nominated 5 times for Nobel Prize, but he never received it. And today it is said that Nobel Prize needed more Gandhiji than he needed it. With this, I would like to congratulate all our awardees in advance for their such a big achievement. Thank you very much. Thanks a lot.
Thank you so much, sir, for that. Now I'd like to welcome on stage Shri Rajiv Arora, Chairperson, Quality Assurance Authority, Government of Haryana, Co-Chair, Expert Group, National Center for Disease Control, Ministry of Health and Family Welfare, Government of India. So please come up on the stage and share your opening address. Can we have a round of applause for sir, please?
आज के इस समारोह में मुख्य अतिथि आदरणीय श्री गणेश भाई पटेल, हेल्थ मिनिस्टर गुजरात, वॉइस ऑफ हेल्थ केयर के श्री नवीन जी, इंडियन स्ट्रोक एसोसिएशन के ऑफिस बेयरर्स डॉक्टर अलुरकर, श्री अरविंद जी, एंड यहाँ पे इस समारोह में बैठे हुए सभी विद्वत डॉक्टर साहिबान, मुझे जब नवीन जी ने ये कहा कि एक इंडियन हेल्थ एसोसिएशन के द्वारा एक स्ट्रोक के ऊपर ये कनक्लेव किया जा रहा है और उन्होंने मुझे चंडीगढ़ से यहाँ आने के लिए आमंत्रित किया, तो मुझे भी बड़ा अजीब सा लगा कि एक जो स्पेशलाइज्ड टॉपिक है उसके ऊपर मैं एक पब्लिक सर्वेंट जो है वो किस प्रकार से रेलेवेंट होऊंगा। और मैंने उनसे ये पूछा भी कि भी इसमें तो दे विल बी डिस्कसिंग थिंग्स विच आर far more kind of medical in nature, clinical in nature, other things, and there's hardly anything which I'll be able to contribute. And it is then that he told me that we are not concentrating only on the stroke part of it, but we are also concentrating on the entire ecosystem which is surrounding the stroke and how we can see to it that this kind of thing should not ultimately develop into some kind of pandemic and become a public health emergency sometime. So I personally feel that it's a very, very good move on their part, because they have tried and collected people from all walks of life. जब भी हम ये गवर्नमेंट ऑफ इंडिया ने ये कमेटी बनाई, नेशनल एक्सपर्ट ग्रुप ऑन द रीस्ट्रक्चरिंग ऑफ द NCDC, और मैं भी उसका एक को चेयर हूँ, so we have been seeing that many of these things, they have come into focus after the corona pandemic, not only in India but all over the world. And all over the world now, policymakers, planners, public health specialists, public health consultants, and of course the clinicians and the doctors and others, they are all now coming around to the view that as far as the disease control is concerned, it is not the disease per se, but the control of the entire ecosystem of the disease. Right from the time you start the surveillance part of it, then you see that what is the total preparedness and response for that particular in times of emergency. Whether you have, in fact, I always say that as far as the stroke is concerned, it is only when the stroke occurs that the doctors come into being. But prior to that, it is in the domain of a lot of public health workers, a lot of people who are extension workers, and they are the ones who can do the maximum preventive part of it. And that is why a large number of policies which have been made by Government of India in the last few years, some of them prior to COVID and many of them during COVID and after COVID, especially I would say the NCDs has been now receiving lots and lots of importance in Government of India. The non-communicable diseases now are accounting for almost 60% of all deaths which are caused in the country. And in the NCDs, stroke also contributes one of the highest, not only the number of deaths, but also the disability part of it. So it is very important that just as we have created a full ecosystem for the communicable diseases right from the surveillance part of it, and the entire chain has been kind of mapped and everybody knows that how to go about it. The lab systems are there, the whatever are the vaccination systems are there, other systems are there. Similarly, now we need to take this more as a movement. And out of all the NCDs which are prevalent now, this is what I was discussing with the office bearers of the Stroke Association also, that whether it is the cardio diseases or it is cancer or it is diabetes, hypertension, they become, they occupy far more space in the mind of the patients, in the mind of the doctors, in the mind of the policymakers than stroke per se. So it is very important that there has to be a very concerted effort by all the stakeholders concerned to show that how important it is to focus on the stroke-related diseases and the stroke-related disabilities, which will ultimately result in tremendous amount of expenditure, mental harassment, all those things which are associated with it and which are not associated with many of the contributory factors. The hypertension, diabetes, other things, they may be contributory factors to this, but per se they don't kind of get into any kind of death situation. So I would say that the importance which is being given to the cardio diseases, cancer, or after COVID respiratory related diseases, that is something which should also be given to stroke. And I think in that context, I would like to congratulate the Voice of Healthcare, the Indian Association, the Indian Stroke Association, and all the other stakeholders who are here, not only for organizing this get-together, but also getting people from various walks of life, and also kind of acknowledging and recognizing the contribution they have made in this particular field. My sincere congratulations to them and to all the persons who are going to win these prizes. I would also like to congratulate and thank the Honorable Minister for having spared time for these things, because generally speaking, this again being a very niche area, a lot of people don't kind of attend these kind of conferences from the public policy point of view. But to give it a kind of note on a public policy front for a clinical disease, I think that is something which is the need of the hour. With all this, I again congratulate you. Thank you very much.
Thank you so much, sir, for your kind words. And now proceeding forward, I'd like to call upon the stage Padma Shri Dr. Sudhir Shah to kindly come up on the stage and say a few words in the opening remarks. Can we have a huge round of applause for sir, please?
Thank you very much. I am overwhelmed with the august presence of our Honorable Health Minister. Please once again give a large applause for one of the most senior men of our Gujarat cabinet, most hard-working and visionary health minister that we have so far, and so kind personality that with a very short notice, in a very sober word, he agreed to come. He derouted. He wanted to go to somewhere else, but just to, grace this function, he has come here for 15 minutes. So we are so grateful to you, sir, for your kind presence. I thank all the stakeholders and all our colleagues, friends who have come all across from different parts of India. आज की बात कुछ बातें करने की नहीं है, अब एक्शन करने की है, एंड आई एम श्योर आवर health minister from Gujarat as well as health ministry from all over India would give a boost to our energy, to our hard work and our vision of stroke awareness, stroke prevention, stroke care, immediate treatment, rehabilitation and all that. Sir, just to tell in 2 minutes what is the problem. So I'm sure you know, and the way you have worked hard in Corona and you have just guided and led us, and we did massive work during Corona episode. You know our health problems. But sir, stroke is a neglected area in a way. विश्व का नंबर 2 कॉज ऑफ डेथ स्ट्रोक है. विश्व का नंबर 1 कॉज ऑफ डिसेबिलिटी स्ट्रोक है. Every 40 seconds, one Indian gets a stroke. Every 3 minutes, one Indian dies of stroke. There are 80% of the causes of stroke which are totally preventable. While a patient gets a stroke, 80% of time it is missed that it is a stroke. During stroke, when the blood vessel is occluded in the brain, every second 32,000 neurons die. On that count, sir, we lose 1.9 million cells, 19 lakh kosho per minute. They are dead if their patient is not treated in 1 minute. And if we lose 1 hour, we lose 1.2 billion cells of the brain out of 100 billion neurons. So that is the magnitude of the problem, sir. And nobody is really aware of the symptoms. There are very few, handful of neurologists, around 2,800 neurologists are there practicing in India, maybe now 3,000 at the most. Akha India na 1.4 billion population સામે માત્ર 3,000 neurologists અમે આ ક્રુઝેડ લઈને કામ કરીએ છીએ. We want your help, sir. Government has a lot of things to help us, and we look forward with a lot of expectations from all of you, your ministry, and I'm sure when you would call us, our delegation will come and we can discuss how best we can take this task forward for education of patients, for prevention of stroke, which is 80% preventable, immediate treatment, building up stroke care units, and also to drive the best possible treatment, including rehabilitation. without taking much time, I once again thank all the stakeholders, particularly Voice of Healthcare people who has initiated this task, government people, Dr. Arora and others, the Indian Stroke Association. Give a big hand to our Indian Stroke Association and all of you friends who have come from distant parts of India for this noble cause. Thank you. Thank you so very much.
Thank you so much, sir. And now, the speech and the address that we have been awaiting for since so long, I would now take the honor of welcoming our chief guest on the stage, Shri Rishikesh Ganesh Bhai Patel, sir, Minister of Health and Family Welfare and Medical Education, Higher and Technical Education, Law and Justice, Government of Gujarat, to please come up on the stage and share his opening remarks. Sir, please come up on the stage, and can we please welcome sir with a huge applause.
आज आप सब पूरे भारत भर से पधारे हुए लर्नेड डॉक्टर श्री और साथ में जिन्होंने इनोवेटिव वर्क किया है, एक्सेलेंस वर्क किया है, उन सब के साथ आज मुझे यहाँ उपस्थित रहने का मौका दिया सुधीर भाई ने। पहले मेरा कार्यक्रम था कि मैं रहूँगा, आपकी बातें भी सुनूंगा और सुन के कुछ ज्ञान आपसे प्राप्त करके यहाँ से जाऊँगा। आपकी कुछ थोड़ी बहुत कुछ बातें होंगी तो वो शेयर भी करेंगे और सरकार उसमें कैसे मदद कर सकती है इसके लिए भी कुछ चर्चाएं भी होंगी। लेकिन हमारा एक पॉलिटिकल कार्यक्रम आ गया। पहले तो सुधीर भाई को मना भी किया राजीव जी, लेकिन हुआ ऐसा कि मन तो था कि आने का और थोड़ा 15 मिनट 20 मिनट के लिए आप सबके बीच में रहने का मुझे मौका भी मिल गया। इसलिए आप सबको भी भारत भर से आए गुजरात में आप सबका वेलकम भी करता हूं। और वेलकम इसलिए करता हूं, आपने एक ऐसे स्टेट को चुना है जो हेल्थ के बारे में पूरा ट्रांसफॉर्मेशन जो शुरुआत हुई, चालू हुआ, वो गुजरात से हुआ। यहाँ पर गरीब मध्यम वर्ग के लोगों के लिए खास फैसिलिटी चालू की गई। उनके आउट ऑफ पॉकेट एक्सपेंस के लिए भी चिंता सरकार ने की। माँ कार्ड, माँ वात्सल्य कार्ड, एनसीडी के सब इलाजों के स्क्रीनिंग के लिए यहाँ पर हमारे हेल्थ एंड वेलनेस सेंटर से लेके पीएचसी सीएचसी तक बहुत बड़ी मात्रा में यहाँ पर डायबिटीज़, बीपी और एनसीडी के सभी दर्दों के लिए यहाँ जो गांव में रहने वाले लोग रहते हैं उनको पता भी नहीं होता है कि बीपी हो गया है और फिर एक दिन ऐसा होता है कि स्ट्रोक आ गया, दिल चला गया, दिमाग चला गया और आप तो दिल और दिमाग दोनों के एक्सपर्ट हो और दिल के साथ भी खेलते हो और दिमाग के साथ भी आपका सबका नाता रहा है और एक्सपर्टाइज ये सब्जेक्ट भी है। और मैं ये मानता हूँ कि जितना अवेयरनेस बढ़ेगा और अपने लाइफस्टाइल से लेके स्क्रीनिंग तक सबके अंदर आपका कंट्रीब्यूशन भी बहुत पैमाने पे और बहुत लोगों के बीच में ये सब बातें जाएंगी। तो जितना ड्यूरेशन बताया है कि हर 14 सेकंड के अंदर एक स्ट्रोक आता है, 30 सेकंड के अंदर एक डेथ होता है, तो उसमें वो ड्यूरेशन भी बढ़ाने के लिए इसकी पूरी नीचे तक लोगों तक अपने जीवन जीने का तरीका और साथ में प्रिवेंशन कैसे हो इसके लिए बहुत सारे विचार विमर्श और यहाँ पर बहुत सारे लोगों ने बहुत अच्छे काम भी किए होंगे। एक्सेलेंस अवार्ड भी मिलेगा, इनोवेटिव भी कुछ आइडियाज़ के साथ आप सब ने काम किया है और भारत भर में आज भी बहुत सारे डॉक्टरों की ज़रूरत भी है। उसमें स्पेशलाइज सब्जेक्ट जो भी रहते हैं, एमडी बनते हैं, स्पेशलाइज डॉक्टर भी बनते हैं, लेकिन फिर भी जितनी तादाद में भारत की बस्ती है उसके हिसाब से मेडिकल के जो डॉक्टर्स हमारे पास अवेलेबल है कम है। आदरणीय नरेंद्र भाई मोदी साहब ने हर जिले के अंदर मेडिकल कॉलेज के लिए बहुत सारा एफर्ट भी किया है और गुजरात के अंदर आज 40 मेडिकल कॉलेज बन भी गए हैं, 7050 जितनी यूजी सीटें, करीबन 3600 जितनी ये पीजी सीटें भी हमने बढ़ा दी है। अगले समय के अंदर 4-5 साल में इसका रिजल्ट भी मिलना चालू हो जाएगा। लेकिन एक समय ऐसा भी था कि जब हम असेंबली में बैठते थे तो विरोध पक्ष के ओर से जो सवालात आते थे उसमें डॉक्टर नहीं है, डॉक्टर क्यों रखते नहीं है, ऐसे सवाल आ रहे हैं। अब ये लगभग करीबन वर्ग 2 के डॉक्टर जो एमबीबीएस है वो तो हमने सब जगह पे रखने का पूरा प्रयत्न भी किया है और उसमें हम 95% सक्सेस भी हुए। फिर भी जो स्पेशलाइज एमडी एमएस डॉक्टर हमें चाहिए वो अभी भी इतनी मात्रा में नहीं मिलते हैं। और स्वाभाविक है कि दूर दराज के विस्तार में जाना होता है, आदिवासी विस्तार में जाना होता है, या कोई दरियाई पट्टी पे जाना होता है, रूरल एरिया में जाने के लिए अभी भी डॉक्टरों की तैयारी भी नहीं है। वजह तो बहुत सारी रही होगी, क्योंकि बहुत समय के बाद वो डॉक्टर भी बनते हैं। करीबन एक अच्छा डॉक्टर बनने के लिए 30 से 32 साल में वो डॉक्टर निकल के बाहर आता है। फिर वो क्यों जाए विलेज में, क्यों जाए आदिवासी विस्तार में, अपने बच्चों को भी देखना पड़ता है और बहुत साल तक करीबन आधी जवानी डॉक्टर बनने में गुजारनी पड़ती है। तो हम चाहते हैं कि ये सेवा का मौका भी है और माध्यम भी है, लेकिन जब डॉक्टर बहुत सारे निकलेंगे तो अच्छी तरह से हम पूरे गांव तक और अंतिम आदमी तक, जो छोर पे बैठा हुआ आदमी है, उसके लिए हम ये सेवाएं उपलब्ध करा पाएंगे। यहाँ पर हमारा स्क्रीनिंग का कार्यक्रम एनसीडीज़ का खूब अच्छी तरह चालू भी हो गया है। लास्ट ईयर से हमने इसको एक आंदोलन के स्वरूप में लिया था। पहले लोगों को पता भी नहीं रहता था कि बीपी है, डायबिटीज़ है, कैटरेक्ट है या कुछ किडनी की बीमारियां हैं। तो अब ये धीरे धीरे अवेयरनेस भी बढ़ रही है, लेकिन जो सही मायनों में उसका बचाव कैसे हो, सीपीआर का ट्रेनिंग भी दिया हार्ट अटैक के लिए। और अभी तो हमारे गुजरात राज्य में टॉक ऑफ द टाउन स्ट्रोक, हार्ट अटैक का बहुत बड़ा इश्यूज़ और विषय भी यहाँ मीडिया में भी चल रहा है। रोज़ इतने हार्ट अटैक आ रहे हैं, बच्चों को आ रहे हैं, जवानों को आ रहे हैं, बूढ़ों को भी आ रहे हैं। ये सब मिला के एक ऐसा नैरेटिव सेट हुआ है कि ये कोविड की वजह से हुआ है। और आप सब जानते हैं कि ये कोविड की कोई वजह नहीं है, वैक्सीन भी कोई वजह नहीं है। लेकिन इस बात की अवेयरनेस के लिए फिगर और तथ्यों के साथ हमने यहाँ व्यवस्था भी की है, डॉक्टरों की टीम भी बनाई है कि वो पूरा उसके साथ चर्चा विमर्श करके बहुत थोड़े समय के अंदर वो लोगों को ये बात समझाने के लिए आपको चिंता करने की ज़रूरत नहीं है, लेकिन अवेयरनेस की ज़रूरत है। खान पान में, रहने के तरीके में और बहुत सारी चीज़ें, अगर कुछ थोड़ा बड़ा बदलाव अपने जीवन में, अपने लाइफस्टाइल में वो चेंज भी कर ले तो बहुत सारा ये स्ट्रोक का, दिल का भी आ सकता है, दिमाग भी आ सकता है। और कुछ कितने स्ट्रोक आते हैं मुझे पता नहीं है, लेकिन मैं तो 2 जानता हूँ, दिमाग का आता है या दिल का आता है। दूसरे भी स्ट्रोक रहते भी होंगे, लेकिन मैं मानता हूँ कि आप सब जब यहाँ इकट्ठे हुए हैं तो इसका फ़ायदा, यहाँ जो चर्चा भी होगी या कुछ आप सब बैठ के यहाँ पर जो भी डिस्कशन करेंगे, वो डिस्कशन से कुछ न कुछ नया लोगों तक पहुँचाने के लिए उसका वो मसाला भी हमें मिल जाएगा। तो आप सब, मैं मानता हूँ कि बहुत बड़ा इवेंट आप सब ने किया है। डॉक्टर सुधीर भाई और राजीव जी और पूरी आपकी टीम को मैं बहुत बधाई भी देता हूँ, और साथ में ये गुजरात में आप सबका स्वागत भी करता हूँ। धन्यवाद।
Request sir to please stay on the stage, and I'd like to welcome again on this stage to kindly felicitate Minister sir, Shri Rajiv Arora ji, to kindly come up on the stage, Dr. Naveen Nishchal, Dr. Anand Alurkar, Dr. Arvind Sharma, Dr. Sudhir Shah, Dr. Nirmal Surya, Mr. Neeraj Lal, Dr. B.K. Rana. So please come up and felicitate sir.
Before Minister Sir gives the awards, I would request Dr. Anand Alurkar from Indian Stroke Association to say a few words. And then, as time is running out, keep all the awards ready, please.
Thank you, Sri Rishikesh Bhai Patel, for gracing this occasion. It is really a momentous occasion. We have had beautiful discussions throughout the day on the various challenges that face us in managing stroke patients. Indian Stroke Association has been at the forefront of trying to address these challenges for the last couple of decades. We are a 1,500 strong community of neurologists, neurosurgeons, physicians who are dedicated towards stroke prevention and treatment. But obviously we are falling short. The treatment gap is still very huge. Compared to the number of strokes that happen every minute, every day, we have been hearing all the figures throughout the day. The treatment gap is still huge. Probably less than 5% of patients who have stroke and who reach hospital end up receiving the most advanced treatment that is available for stroke. And in this, we need the support of the government, both at the central and state levels, in addressing this issue. Public awareness about the signs and symptoms of stroke, the urgency that is required to take the patient to hospital to get the best possible treatment is severely lacking. We as doctors have been trying hard to take this message across. But when we talk about a certain treatment modality, it comes across sometimes as advertisement for that modality. So ideally, we are not the right people to talk about such things. And herein comes the role of celebrities and governments and politicians and public figures who actually should be talking at various forums. Now, we see these advertisements before every movie about cancer and tobacco and mouth cancer. Why don't we have such advertisements about stroke? Stroke is a much more leading disorder as far as disability and death is concerned, even more than cancer. Probably not as glamorous as cancer or heart disease, but it is right at the top as far as disability and death is concerned. So we need the contribution, we need a strong push from the government in addressing these concerns. Affordability issues are extreme. We are so disheartened many times that when the patient comes to us and we have the best possible treatment to offer to the patient, but we cannot do the best because the patient is not affordable. Here also the government has to, of course it is doing huge work, especially in non-communicable diseases for the last decade or so, but we need a stronger push from the government. Obviously there are so many things which we want from the government, we may not get everything, but it is our job to put forward to the various people like Honorable Minister here. Thank you very much.
Thank you so much, everyone. Once again, a round of applause for these dignitaries present here on the stage. And now we proceed with the felicitation and the award ceremony. I'd like to request Honorable Minister Sir, Rajiv Arora Sir, and Dr. Naveen to kindly stay back at the stage. And we'll proceed with the award ceremony. Well, now, before we begin with each category, with each distinction holder, with each awardee, I'd like to welcome Dr. Sudhir Shah, welcome on the stage to kindly take up his token of felicitation with us. Thank you so much, sir, for your kind contribution to us. Thank you so much for putting this together. Can we have an applause for Dr. Sudhir Shah, sir, please? Thank you. Beginning with the award ceremony, beginning with the first category of the day. Now, each category is divided into two primary categories. We are recognizing the distinction holders and we are recognizing the awardees under the individual and the enterprise categories. The first category of today is Best Stroke Researcher of the Year. Now, again, as I said, for this category, we have two distinction holders and one winner of the award. The first distinction award for Best Stroke Researcher of the Year goes to Dr. Karpuram Govati Nikhila. Can we please have you on the stage, please? The second distinction certificate for the Best Stroke Researcher of the Year goes to Ms. Farheen Khoja. Can we have Ms. Farheen on the stage, please? And the winner of the award for the Best Stroke Researcher of the Year, the award goes to Dr. Pallab Bhattacharya. Dr. Pallab, can you please come up on the stage and receive the award? Thank you so much. Moving on to the next category, Best Stroke Innovator of the Year. The distinction certificate for Best Stroke Innovator of the Year goes to Mr. Abhijit Satani. Can we have Mr. Abhijit on the stage, please? The second certificate of distinction under this category goes to Dr. Rahul Katyal. Can we have Dr. Rahul Katyal on the stage, please? And the winner for Best Stroke Innovator of the Year goes to Dr. Abhijit Roy. Can we have Dr. Roy on the stage to receive the award, please? Category of today is Best Stroke Care Provider of the Year. The distinction certificate for this category goes to Ms. Atira Hirendran. Can we have Ms. Atira on the stage to receive the certificate? The winner for this category under the Best Stroke Provider of the Year is Dr. Thomas Ipe. Can we have Dr. Thomas on the stage to receive the award, please? Next category by the name of Best Stroke Physiotherapist of the Year. The certificate of distinction for Physiotherapist of the Year goes to Dr. Gaurav V. Shah. Can I have Dr. Gaurav in the front, please, to take the certificate? The second certificate of distinction under the category Best Stroke Physiotherapist of the Year goes to Dr. Hiral Gandhi. Can we have Dr. Hiral to please come up on the stage? And before we continue with the further set of awards and certificates, I'd like to inform everybody that Honorable Minister Sir has some commitments to make and Sir would like to probably proceed further. So I think before proceeding with the award, further awards, let's once again thank Sir for his kind contribution, for his kind words and presence here today. Sir would be leaving us soon. The award for the Best Stroke Physiotherapist of the Year goes to Dr. Priyanka Sethi. Can we have somebody on her behalf to receive the award on stage? Moving on to the next category. The category is Best Stroke Educator of the Year. The certificate of distinction for the Best Stroke Educator of the Year goes to Dr. Vivek Harsukbhai Ramanandi. Can we have Dr. Vivek, please? The award for the Best Stroke Educator of the Year goes to Dr. Chaitali Jamini Kumar Shah. Can we have Dr. Chaitali or somebody on her behalf? The upcoming category is Best Neurology Trailblazer Award of the Year. The certificate of distinction for Best Neurology Trailblazer Award of the Year goes to Dr. Anil Kumar Sivan. Can we have Dr. Sivan on the stage, please? And the award for the Best Neurology Trailblazer of the Year goes to Dr. Kunal Bahrani. Can we have Dr. Kunal on the stage to receive the award, please? The next category is Best Neurosurgical Excellence in Stroke Care. The certificate of distinction for this category goes to Dr. Sandeep Mawani. Can we have Dr. Sandeep up on the stage to receive the certificate? And before we proceed for this award, I'd also now like to welcome on stage the jury panel who have put together all the efforts and shortlisted all our certificate holders and award winners. Up on stage, I'd like to welcome Dr. Anurag Saxena, Dr. Anand Alurkar, Dr. B.K. Rana, jury panel also included Mr. Rajiv Nath from AMED, but unfortunately he could not be here with us physically. But moving on to the award for the Best Neurosurgical Excellence in Stroke Care, Dr. Sandeep Suresh Chandra Shah. Can we have the winner on the stage, please? The next category is Best Stroke Ambulance of the Year. Now we have the award for Zenzo. Can we have somebody on behalf of Zenzo to receive the award for the Best Stroke Ambulance of the Year? Moving on to the next category, Best Hospital in Stroke Care. The first certificate of distinction for Best Hospital in Stroke Care goes to Bhailal Amin General Hospital. Can we have somebody from the hospital to come up? The second certificate of distinction under the category Hospital in Stroke Care goes to Adikura Super Speciality Hospital. Distinction for Best Hospital in Stroke Care is for Nirmal Hospital Private Limited. And proceeding the distinctions, the award for the Best Hospital in Stroke Care goes to Mazumdar Shaw Medical Center, Narayana Health. Can we have somebody from the hospital, please? The upcoming category is Best Physiotherapy Center for Stroke Care. The certificate of distinction under this category is for Rewalk Robotic Rehab. Can we have them on the stage, please? Can I also request and encourage all the attendees to kindly honor all the award certificate holders for their applause. The award for the best physiotherapy center for stroke care goes to Maitra Hospital. The upcoming category for this is Best Telemedicine Services for Stroke Care. The award for the best telemedicine services for stroke care goes to Believers Church Medical College Hospital. Moving on to the next category, Best Stroke Research Organization of the Year. The award for the Best Stroke Research Organization of the Year goes to Aster MIMS Hospital, Calicut. Can we have representatives, please? The next category is Best Stroke Impact Initiative. Now, the first certificate of distinction under this category goes to Parul Sevashram Hospital. Can we have somebody from Parul Hospital? The second certificate of distinction for the Best Stroke Impact Initiative is for Angels Initiative India. Can we have somebody from Angels, please? And the award for the Best Stroke Impact Initiative is for Max Super Speciality Hospital, Patparganj, Delhi. Best Patient Access and Affordability Initiative in Stroke Care. And the certificate of distinction for this goes to SUT Hospital. Can we have somebody from the hospital to receive the award? I believe they might have to leave because they had a flight to catch. Moving on to the award for the Best Patient Access and Access and Affordability Initiative in Stroke Care goes to Saifi Hospital. The next category for awards is Best Innovation in Stroke Diagnosis, and the award for the Best Innovation in the Stroke Diagnosis goes to Kaveri Hospital, Vadalapani. Can we have somebody from the hospital to please? The next category for award is Best Rehabilitation Innovation in Stroke Care. The certificate of distinction for Best Rehabilitation Innovation in Stroke Care is for Karji Care. Can we have somebody from Karji to please come up? The second certificate of distinction under this category is for Charukesi Healthcare Private Limited. category for best rehabilitation innovation in stroke care is for AIMS Bilaspur. Can we have somebody from AIMS Bilaspur to come up, please? Category for award is Pioneer in Stroke Care Standardization. The certificate of distinction for Pioneer in Stroke Care Standardization is for Kusum Dheerajlal Hospital. Can we have KD Hospital's representations come up, please? The award for the Pioneer in Stroke Care Standardization goes to Senthil Multi-Speciality Hospital. The next category is Best Stroke Care Campaign by Hospital. And the award for the Best Stroke Care Campaign by a hospital goes to Nanavati Max Super Speciality Hospital. The next category is Best Clinical Excellence in Acute Stroke Care. The certificate of distinction under this category is for Aster MIMS Hospital, Calicut. Can we have an applause, please, for all the certificate distinctions? Category goes to Kaveri Hospital, Alvarpet. Can we have Kaveri Hospital come up? The next category is Best Hospital for Excellence in Stroke Treatment. And the award for this category is for Apollo Hospitals International Limited, Ahmedabad. The next category is Best Comprehensive Stroke Center. And the award for the Best Comprehensive Stroke Center is for Ankinedu Stroke Center, Lalita Super Specialities Hospital. The next category is Best Stroke Awareness Advocate Hospital of the Year. And the award for this category is for Aster Ramesh Cardiac and Multi-Speciality Hospitals Private Limited. The next category is Best Emerging Stroke Unit. And the award for this category is for First Neuro, Brain and Spine Super Speciality Hospital. The next category is Best Stroke Ready Hospital, and the award for this one is for Baby Memorial Hospital. The next set of awards is under the category Best Patient-Centric Stroke Care Hospital, and the award for this one is for Apollo BGS Hospitals, Mysore. The next category for today is Best Stroke Care Quality Improvement Hospital, and the award for this category is for Dr. Vanchilingam Hospital. Can we have somebody from Vanchilingam please? Thank you. And the final award for the Stroke Community Empowerment Award. And this award is for Indian Stroke Association. Can we have the award and the representations already on the stage? Can I have Dr. Arvind Sharma on stage, Dr. Nirmal Surya on stage if sir is here, and Dr. Anand to receive the award? And with that, we wrap the award ceremony, but we'd like to congratulate each and everyone, each the certificate distinction holder, every award winner for this category and award winning today. Thank you so much. But before further proceedings, we have a couple of awards left. We also want to recognize the best winner for poster presentation and also want to recognize our partners today, without whom it was difficult to put this conference together. So, starting with our supporting partners, I'd like to congratulate QAI for supporting us, and I'd like to request Dr. Rana to receive the award. Our care partner, Apollo Hospitals. Can we have somebody from Apollo Hospitals or Neeraj sir to come up and receive the award? Our supporting partner, World Rehabilitation Alliance. Can we have somebody receiving the award? Moving on, our institutional partners, Institute of Public Health, Gandhinagar. Moving on to our industry partners, thanking Lyceum. Can we have somebody from Lyceum to speak? have somebody from MCure to come up on the stage? Pharmaceuticals. Can we have somebody from Torrent to receive the certificate? Can we have somebody from Torrent? Can we have somebody from Omron to come up and receive the certificate? Somebody from Omron? Can we have somebody from Boehringer Ingelheim to come up on the stage to receive the certificate? Pharmaceuticals. As I mentioned, we'd also like to announce the winner for the poster presentation competition, which was under the campaign theme Stroke Care Innovation. And the winner for the poster presentation is Dr. Vishal Karmani. Can we have Dr. Vishal to come up on the stage, please? Now requesting further felicitations, I'd request Dr. Naveen Nishchal to kindly felicitate Shri Rajiv Arora ji for your presence. Sir, your time was so valuable for us. Appreciating the jury panel for the award ceremony, our jury member Dr. B.K. Rana, Dr. Anand Alurkar, and Dr. Anurag Saxena. And that was the final set of recognitions and certifications for today evening. Thank you so much for being present here with us today. Have a great evening. Thank you. We have a few welcome drinks and snacks present there. And before we move forward, can I proceed on stage and can I request all the award winners to come up in the center for a group picture? Can I have all the award winners to please come up for a... Let's have all the winners please come up in the front. Our jury, ISA members. Thank you so much. Dr. Arvind Sharma, if you'd like to say something to all the...
Thank you very much, and congratulations to all the winners from Indian Stroke Association also. And I'd like to announce for the next edition of collaboration with VOH and Indian Stroke Association, the second edition will be held in Delhi, New Delhi. So round of applause for New Delhi. We are going to Delhi next year. So looking forward, the association of ISA and VOH together. Thank you very much. Thank you for being here, and congratulations to all the winners. Thank you very much. Thank you, Dr. Naveen. Thank you, Dr. Pinky. Thank you, Mr. Neeraj. Thank you. And thank you, my president, Dr. Anand Alulkar.